Well, joint pain is a big problem in our country. More than 32 million Americans are dealing with arthritis right now. Specifically, the most common form of it, osteoarthritis. And treatment for this condition is advancing quickly, and it turns out using radiation is one of the ways people are getting help. And here to give us some insight is Dr. Michael Nichols, a radiation oncologist with Novant Health. Thank you so much for coming in. Appreciate it.
Thank you for having me today.
First, help us understand exactly what osteoarthritis is.
Sure. Osteoarthritis is a degenerative condition that over time can affect joints and cause some people to lose mobility and have pain in those joints.
Is there an age range for that? Because I feel like I've heard it brought up for, maybe middle-aged people even.
Right, and so the statistic is that 90% of all patients are over the age of 45.
Oh, wow. And so is any joint pain that you're feeling, are there causes for it?
Yeah, sometimes it's osteoarthritis, but it could be other types of arthritis, such as rheumatoid arthritis or various other types.
And the new treatment for osteoarthritis is radiation, which I was shocked to hear. It might surprise people to hear that.
Right, and so radiation is used, as most people know, to treat cancer in a lot of cases. Low-dose radiation is something very different. With low-dose radiation, it's a very low dose of radiation, a very safe dose of radiation, to a very small field.
And that targeting is the small field that you're talking about?
Yep, the small field is targeting that joint. And so we can get relief of joint pain and improve mobility in about 85 to 90% of all patients.
Oh, wow. So it's been proven to be pretty successful.
It has. And it's actually been around for a long time. And so the first case was treated in 1898, believe it or not.
Oh, wow.
And was used commonly in the U.S. up until the 1980s. And then about that time, naproxen came around, and it somewhat fell out of favor here in the U.S. It was still being done in Europe and continues to be done in Europe every year on tens of thousands of patients.
Why did it come back around now?
We're not sure. We're not sure why it fell out of favor, but it's come around now because the data is really strong, and it's such a low dose that there are essentially no side effects, which feels strange to say, but it's true. And I would quote one study of over 1,000 patients. One patient had very minor skin irritation, and that was it.
I think a lot of people will be very happy to hear that, though, because like I said, when you hear radiation, you think, oh no, I don't want that, what it does to my body.
It sounds scary, yeah, but it's actually very safe at these very low doses to very small fields. And I think another important point to be made is that getting the low dose radiation does not stop patients from getting any other available treatment, whether it's steroid injections or joint replacement.
All right, very interesting information. Thank you so much for joining us.
Thank you for having me.